Do you have concussion, or do you know somebody who has concussion? Whether it's the headaches, the vision problems, it could be hearing issues, vomiting, feeling sick to your stomach, disoriented, foggy feelings in the brain, even amnesia, dizziness, abundance of tiredness. If this is you or you know somebody who has concussion-like symptoms, then in today's video, I'm gonna explain what is going on, what you can do in order to get better, but also 3 of my favorite supplements that you should be taking that's gonna get your body to calm down and, more importantly, heal. I'm Dr. Matthew Posa, and I'm a chiropractor in Milton, Ontario, Canada. I help people get better from their spine-related health issues so they can live the life they were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. Concussion is definitely something that's on the rise. It's something that we're made way more aware of, and it's something that I see way more of. We're seeing it not only in a younger population, but we're really seeing it throughout, because it's car accidents, but then it's falls, it's things like sports. And when you have trauma to the brain, there's a neurological change that's happening and your body is giving you those signs. So what most people are suffering with is the issues that are surrounding the brain's ability to heal. If you're suffering with this, what we need to go through today is understanding what the symptoms are telling you, what you can do at home, but also some of the supplements and things that you can take in to really get your body to the point of healing. One of the red flags I want you to look out for, though, is especially if you have your headaches, you're noticing that they're getting worse. So that is a red flag. That is something that you need to make sure that you go talk to your family doctor and or you go to emergency, and that we're taking the proper precautions, whether or not you need a scan or an MRI or a CT. So that is a discussion that needs to happen with your family doctor. Other red flags is the constant repeating vomiting, like you're really not stopping. And the other one that I would really watch out for is anybody who loses consciousness for longer than 30 seconds. Again, these are conversations you want to have with your family doctor. You want to go to either emerge or go get the proper testing in order to know what's going on. When we test for concussion, really what we're looking for is what part of the brain has been affected. And so one of the best ways that we can get that information out of you is by measuring your eyes. It's looking at the eyes, whether we're looking at how the eyes are tracking, whether or not they're able to do exactly specific movements, but we're also looking on focusing, how your body can focus onto things. And that tells us different parts of the brain as far as where the damage has happened or where the bruising has happened, and therefore what we need to do in order to take the pressure off and then start rebuilding those neurological pathways. Most treatment is going to be around vision. So as a chiropractor, we do not deal with vision issues. However, we do love to refer to the right people who do this type of work. And so I love working with anybody who does concussion work, but that is functional concussion. So I'm looking to see anybody who understands this field, who is an expert in this, and who's going to use, most of the time you're going to notice, eye tracking exercises and things in order to calm the system down. But here's the trick. Whenever we're doing these exercises, what you don't want to do is get to the point where you're pushing yourself past it. This isn't like working a muscle out. What we need to do is push your body enough where it's learning, it's building down new neurological pathways, but that we're not overdoing it, so that way we're not creating more inflammation. Other things that we can look into would be hearing. We're going to measure things like strength and see if there's issues in the muscles and coordination, balance, reflexes, and memory and recall. Those are all areas of the brain that we're looking for, but those are all exercises that we would do. So depending on where we see that issue, that really tells us what we need to do. And so I love working with those who do the concussion protocols, who do excellent work with that. However, on a chiropractic point of view, what we're trying to do is seeing where the spine has shifted. Where has the body taken on the trauma? What happens is you got to think of it like your nervous system is going to protect itself. And so you have all these joints in your spine. And so what happens quite often is when somebody goes through trauma and they get hurt, one of these bones can go out of place. And when these bones go out of place, it interferes with your body's ability to heal itself. And so quite simply, all we want to do is make sure that the spine is in line, that there's less pressure off your nervous system. So that way, when you're doing this functional rehab and you're working on some of the visual exercises or the memory recall or whatever it is that you need to work on, that your body is in the best position to do so. So if you are somebody who is suffering with this, it's lingering, it's been too long, or maybe you've tried that other stuff and you notice you're having roadblocks, you're not getting to where you need to get to. What you do need to do is make sure that your nervous system is clear, that your spine is clear, and so that way you're becoming more effective when you use those exercises. Often it is the missing link. So treatment, it really looks at what can we do to take the pressure off the nervous system, off that part of the brain, but rebuild the pathways that have been damaged. And so oftentimes we're going to do a lot of visual things. In chiropractic, one of my favorite tests to see before and then after the adjustment is visual fields. And so what ends up happening is a lot of people who have concussion, you could tell that the brain is really under pressure because they become way more narrow. So how much they can see, just by simply bringing your hands to the outside, you'll notice their visual field is not big. So they are clearly having issues. However, right after we do an adjustment, their visual field extends. And what's really amazing is that it's instant. So by adjusting the spine, we're removing that. And then the moment that you start doing some of the exercises, then you're going to notice far greater improvements. One of the number one mistakes people make is that they try to get back to things too soon. They try to get back to their normal life. The hard thing is whether or not you're really young, you're a student, you're in school, or you got a job and you got to perform, you got to do work. Well, the problem here simply becomes you need to stay away from anything that's stimulating, whether it's lights, whether or not it's computer screens or the TV, and you need far more rest than you think. You need to be in a darker place. You need to be in your room without any type of lights, without anything, because your brain needs to have nothing around, no sounds. It can't have extra stimuli. So you need to put yourself in one of those positions where you can lay down, you can get rest, you can't worry about work or going to school or anything like that, and it's literally no stimulation. That is really hard for people because then the next thing becomes, well, can I read a book? And the answer is no. And why you don't want to read a book is because your eyes are working really hard at reading the page. And often you have to have a light on in order to read a book, and therefore it becomes a strain on your eyes. And that isn't what we're trying to do. We're trying to build it up with the exercises, but once the exercises are done, you don't want to continue. Now, as your body does improve though, what you can do is I would go find yourself some blue light blocking glasses. Here's an example of blue light blocking glasses. You'll notice that they just look like regular glasses. However, there's a slight yellow tinge to them. And often you can see it or you can't, but the point is that we're blocking the light that's coming into the eye. And blue light really has a negative effect on the body. More importantly, it affects your body's ability to fall asleep and stay asleep. So if we're trying to heal from the inside out and get your body that rest, the more stimulation you have, the harder it is. So this is a great step in the right direction, but you really want to limit your screen time to 30 minutes or less. And that can be quite hard for a lot of people. So that's why in the first 28 days, what you're going to do as you're working functionally, getting your exercises in, you're getting more sleep, you're getting more rest, but you're not on your phone, you're not on the computer, and you're definitely not watching TV or reading, then what you're going to start doing after about 14 days of doing this, as long as the symptoms are improving, meaning you're getting less headaches or the fogginess or the dizziness, definitely no vomiting or anything like that. I mean, most of your symptoms are leaving, memory is coming back, or your ability to recall things is coming back. Then what you can start doing is throw these on, and then you're going to do about 30 minutes up until the 28-day mark. So really for 1 month, you're going to be working purely on yourself to get yourself back to normal. And the last thing I want to go over is what supplements you should be taking, because you should be taking supplements. Your body will require more in this state in order to heal. And so you got to make sure you're giving your body what it needs. The number one supplement is going to be magnesium. You need to give your body magnesium. Not only is it a natural muscle relaxant, it's calming, but it helps your brain heal. And so magnesium has to be implemented. In this case, you want to be about 500 to 600 milligrams. So we want to go a little bit higher than sometimes what the bottles recommend. Now, the key with this is to be quite careful, because magnesium in a higher dose can upset your stomach. So this is why when it comes to magnesium, either I'm looking for something that has most of the different types of magnesium all clumped together, but really if I'm taking a single magnesium, well then I'm going to be looking for magnesium biglycinate or magnesium glycinate. And if you're not new to my page, you'll know that that is my #1 supplement that I always recommend to people, because you will get a better night's sleep, your body will heal, it'll help with muscle aches and pains, it even helps your digestive tract get better. So this is definitely on the top of your list. My next favorite supplement is vitamin B12. Now what's really important with vitamin B12 is whenever you hear B, I want you to think brain. And so this is excellent at helping your nerves and your brain heal. However, when it comes to vitamin B12, I want you to look out for this. Often when you're looking for these supplements at the store or online, what you want to look out for is the form of cobalamin, which is the name of vitamin B12. And so cobalamin comes in many different forms. And the synthetic form is called cyanocobalamin. Now, that is going to be the one that you're going to notice the most. You're going to see it the most, whether or not it's in the back of the bottle or you're going to see it advertised. However, cyanocobalamin, even though it is the most used and probably the most often one that you're going to find, it isn't the best form, because cyanocobalamin, just like the word says, cyano, it comes from cyanide. And cyanide, in the synthetic form of cyanide, is they're able to derive the B12 from this. However, what it does is it has a lot of inflammation associated with it. So therefore, it isn't the one that your body absorbs the best, and it tends to cause more inflammation when you're taking it. So we want to avoid taking cyanocobalamin. The other two forms that I really like is one called methylcobalamin, which is the most bioavailable form of it, and it becomes really easy to absorb, and it doesn't cause any type of inflammation. However, in this case, the type that I want you to take is adenylcobalamin. Now, adenylcobalamin is an important molecule. What it does is it works on the mitochondria inside your brain. Now, the mitochondria is the part of the cell that creates energy, ATP. And in this case, whenever you've had brain trauma or injury, what happens is your body requires more energy in order to heal. And so when you're taking this form of it, it's not only going to help supply with the cobalamin, it's going to help your body to heal and it's going to help the nerves, but it's actually going to help ATP production within your brain, which is going to elevate how much ATP is available for your brain to use in order to heal. So this is vital in order for you to get better, and it is often something that a lot of people are not taking. You want to take about 2.4 micrograms of this if you're above 14 years old. Now, in some cases, you can take a little bit more. However, that is a conversation you need to have with your family doctor. And also, I always advise whenever you're taking any type of supplement, it's good to know your levels. So I would go get a blood test to really confirm where you're at and therefore how much you should be supplementing. It is the best way to do it. And the last thing that is definitely on my list is going to be fish oils, but I'm looking for omega-3. Now, omega-3s are not only essential fats, but what this does is your body uses it to coat the nervous system. And when it coats the nervous system, it insulates the nerves, it insulates the way your body sends a signal, and therefore it makes it more efficient and healthier. And so when you give your body this, it's not only going to help your body with the anti-inflammatory properties of it, but it will literally help your body send better signals. So as you're doing your exercises, as your body's healing, your body's going to really see the effects of the treatment and or the work that you're doing. One last thing I want you to consider on top of doing either chiropractic in combination with some functional neurology with your concussion treatment is doing acupuncture. Acupuncture has been one of those things where it's time tested and therefore we know it works. However, it is really good again to calming the nervous system down and using a traditional Chinese methods that they're really able to utilize what they've known for centuries in a way to actually help your body heal. So this is recommended highly because it's also natural. We're not putting any drugs, we're not taking anything out of you. It doesn't require much of your time other than just laying down, and so it is calming and it is an excellent way to get your body to where you need it to be. So if you have concussion, if you have questions about concussion, then please leave it down in the comments down below. Or if you have questions about any other health related issues, you can also leave that down in the comments below. But I am interested in knowing what works for you. If you've had concussion, please let me know down below what worked for you, what did it for you, so that way we can help as many people as possible.